Welcome back for our weekly talk with the Pacific Coast Business Times. Our topic this week is something many families are familiar with, becoming familiar with, RSV.
Certainly, the respiratory virus paid a visit to my house this fall and, like a bad house guest, stayed longer than we would have liked it to. Let's bring in the new executive editor of the Pacific Coast Business Times, Neil Koch, to talk about the impacts of RSV that it's had on our local community. Neil, thank you for joining us. New reporting from your Madeline Ben on your website today highlights a strain on local hospitals. How bad is it getting for RSV here in our local community?
Well, Scott, hospitals along the Central Coast are strained in their capacity to deal with patients being admitted for this, primarily young children. The virus is one that is not new. We're used to it in the symptoms that you mentioned in your household. But it's not usually something to be that concerned about. But with young children and those over 65 or immunocompromised, it can be very serious.
I happen to know an older man right now who's hospitalized with this. There is no vaccine for RSV like there is for the COVID and the flu. What are you hearing from health professionals about ways to protect yourself from getting it? And how do you know if you actually have that versus something else?
Well, our reporter, Madeline Ben, it turned up that the typical symptoms are those we're used to: runny nose, scratchy throat, but they differ somewhat from flu and cold. But those are something that really medical professionals should be consulted about to distinguish the difference between. And again, it's not that much of a concern for normal adults or adolescents. But ways of protecting ourselves involve thorough washing of hands, wearing protective masks, staying away from people who are sick, and if you're sick yourself, staying away from others. Certainly with babies, passing them around would be very popular during the holiday season is something to be avoided.
I was surprised to see a quote in the story on your website that they say it's really, in terms of illness, as bad as it's been since the peak of the pandemic. And there's one report of a hospital or a clinic in San Luis Obispo where they're having to send people miles away because they're full right now.
Yes, in particular for the type of care required to treat young children for this type of ailment, in terms of the respiratory units. The peak is the highest capacity they've run into since the pandemic. And the big fear is the rise in COVID-19 that may converge with this. The clinics in the Santa Barbara area are reporting that the COVID-19 incidence has risen to 18% over the last 4 weeks, just from 3% before that.
Yeah, and one of the big concerns with the symptoms-wise for RSV is the chest congestion, the cough, difficulty breathing, that sort of thing. So if somebody right off the bat is having something along those lines, you assume that's what it is, go to the doctor and you wear your mask and do all the preventative?
Yes, that's always the wisest thing to do. Do whatever you can to protect yourself, particularly in public. When the symptoms come about, the most important thing would be to consult with your physician.
All right. Neil Koch, Executive Editor, Pacific Coast Business Times. Thanks for talking with us today. We'll look forward to more chats with you in the future.
Thank you.